Now, today is World Scleroderma Awareness Day. It's a rare autoimmune disease affecting about 300,000 Americans. Now, for those it affects, it can be challenging to manage. Here to explain more about the disease and the symptoms associated with it, Dr. Jen Caudle. Good morning to you.
Good morning. Good morning.
So I think most of us, I've heard scleroderma.
So that makes me, I'm encouraged by that because I actually wasn't sure.
Okay.
You know, I'm a family doctor and I do see scleroderma in the office. It's not the most common disease. So scleroderma.
Right, what is it?
Yeah, so it's really where, it's a group of conditions where the skin actually hardens. So sclera means hard and derma means skin. The body develops extra collagen and it infiltrates the tissue. So people get skin tightening, but they can also get other organ involvement as well.
Okay, so now as an autoimmune illness,
Right.
you say that it impacts the skin and that's where
Right.
you see it, but generally they're more dangerous than just kind of a skin issue. Is this a dangerous situation?
Well, so there's two types of scleroderma. There's localized, which those people who have localized scleroderma, it mainly affects the skin, sometimes small areas, sometimes large areas. And then there are people with systemic disease, and it not only affects the skin, but it can affect how well they swallow and their esophagus. It can affect their joints. It can affect their kidneys, their lungs, their heart. So it depends on what type you have, and it can vary in severity, honestly, and the symptoms that you have.
So it shows on the skin
Yes.
initially?
Yeah.
So how do you know you have scleroderma and not just a rash or something?
Right. So sometimes people don't actually know that that's what they have because, again, we can think of it as an autoimmune disease. So sometimes the symptoms overlap with other conditions. It can be hard to tell. But some of my patients that have had scleroderma, what happens is like a hardening or tightening of the skin where their skin becomes very, very tight. I have an older woman that has scleroderma, and she looks very young by the face because her skin is very, very taut and very, very tight.
Okay.
But there are other skin manifestations. I mean, some people get actually discoloration, etc. I know it sounds very vague, but the biggest thing I always tell people is if you notice rashes or skin changes, it's really important to see a doctor because we may need to do extra testing to check to see if it's this or others.
Now, I actually have an autoimmune disease called sarcoidosis.
You have sarcoid, okay.
And it's very similar. It
Yeah.
manifests in a lot of different ways.
Right, right.
But you didn't know until I actually went and got tested. So they need to go see their doctor?
That's right. And kind of like sarcoid, you're right, because sarcoid is one of these conditions, right, that people can have skin stuff or inner stuff, lung stuff, etc. So that's why I say, you know, we may need to biopsy your skin, we may need a biopsy, we may need to do lab tests, and we may actually even need to do imaging testing depending on what we think is going on. Yeah, that's why we always say, if you're not sure what's going on, if something doesn't go away, check with your doctor. But I love that there's a World Scleroderma Day. And
it is treatable.
Yes, there's many treatments that can treat it.
Good.
The
Now,
symptoms.
the Delaware Valley chapter of the Scleroderma Foundation is holding its 30th annual Stepping Out to Cure Scleroderma Walk in Philadelphia. It's in September at Memorial Hall, so you have plenty of time to register, and 100% of the proceeds go towards scleroderma research. Dr. Janet, it is always a pleasure when you are here.
Thank you.
It's great
good
to see you.
you.
Appreciate you.